afternoon.
Hi, Deb.
Hi. COPD affects about 27 million people in the U.S., with about half of those afflicted waiting months and sometimes years before receiving a proper diagnosis. Joining us now to discuss this disease is Dr. David Mannino, respiratory expert, and COPD patient Candyce Norris. Doctor, why don't patients open up about their symptoms to their doctors?
Deb, I think there are several reasons for this. In some cases, they may not realize that their symptoms actually represent COPD. They may attribute them, particularly just getting short of breath with activity, to getting older. Sometimes what patients will do is they'll ratchet down their activity because of symptoms. So if you ask them, well, do you get short of breath when you exercise? And their answer is no, but they really don't exercise. And then also, in some cases, patients may be embarrassed by these symptoms. Sometimes, particularly if a patient has been a smoker, that they may feel that this is something they sort of did to themselves, and there's a degree of shame involved with that. And this is something that we're trying to have these educational efforts like this to really change that discussion.
And how important is it to know the severity of COPD for determining management strategies?
It's important to understand different metrics of severity. For example, the symptoms that a patient is having, and also whether they're having exacerbations, and also whether they're having other sorts of risk factors or exposures. Because all these different components go into the plan of how we manage COPD. Our goal in managing COPD is not to not only add years to that patient's life, but to add life to their years so that they can do all the activities that people expect to do as they get old, such as being able to enjoy their golden years, going on vacations, attending graduations, weddings, and other important events of their children and grandchildren. And the way we do this is by approaching multiple different components in disease management. That we want to be sure that risk factors are reduced. So trying to get our patients to stop smoking, or reducing their exposures to other bad things in the workplace, such as dust and gases and vapors. And then trying to get patients on an exercise program, being sure that they're vaccinated against influenza and pneumonia, and then being sure that they're on the right therapies. There are lots of different therapeutic options now for COPD, and we want to be sure that the right patient is on the right therapy.
Doctor, what advice can you share with patients and caregivers to encourage the best possible management of their COPD?
I think patients need to be well informed. And I think I love to have a well-informed patient come into my office. So, and there are various places that people can go for information. I recommend the website of the COPD Foundation, which is copdfoundation.org, that has information for not only patients, but also for caretakers of those patients and for physicians. And Candyce, for example, here has had a interesting COPD journey, and she can attest to example for how important exercise was in her case.
Thank you. Candyce, when were you diagnosed with COPD?
I was diagnosed in 1996, Deb, with COPD. And in the beginning, I didn't take it seriously, but I eventually had to. It's a chronic disease that can progress, and I eventually went to my doctor and was honest and told him about all the symptoms I was having. I opened up to my family, and I took control of the condition instead of allowing the condition to control me.
Candyce, what tips would you share to encourage and help people to open up about their symptoms?
Definitely talk to your doctor. He's not there to judge you. Not there to embarrass you. It's very important that they have the whole picture of what you're experiencing. That's the best way to come up with your health plan for you. Open up to your family. Let them be there available for you. There are times you will really need help. It's harder to handle this on your own. Move around, exercise. Don't be still, because that makes it even more difficult in the long run. So control the condition, keep moving around, be open with your doctor, and use the resources out there like copdfoundation.org. It's a great information. It will help you walk down this path.
I'd like to thank you both for taking the time to talk with us this afternoon. Have a good day.
Thank you,
Thank you,
Deb.
Deb. You too.
Bye.
Bye.